You're listening to the Fix My Feet podcast. Solutions for every step in your journey with the nation's leading foot and ankle specialists.
While walking, you exert about 3 to 6 times your body weight onto your feet. By the end of the day, that can be a few hundred tons, which is equal to 24 semi-trucks. Your feet support your entire body. But what supports your feet? Custom-fitted orthotics can last about 10 years and are doctor approved to help your feet take the pressure of your everyday life. To book your fitting, go to www.prfootandankle.com now and click the Request Appointment button. We look forward to seeing you soon.
Welcome everybody back to the Fix My Feet podcast. I'm your host, Dr. David Waters, a board-certified foot and ankle surgeon here in Nebraska at Platte River Foot and Ankle Surgeons, here with my awesome co-host, Dr. Evan Leonard's surgeon, foot and ankle surgeon, and Ashley Anderson, RPA. How are you guys doing?
Doing well, thanks.
Doing great.
Awesome.
Ready to rock.
Another great episode coming everybody's way. Today we're gonna start a small series that probably go forward periodically, but reviewing some interesting cases or cases that people might find interesting, common pathologies and things that we do with them. And so we're going to review a case today about bunions and talk about the evaluation of bunions and what exactly a bunion is. If you're on YouTube, you'll be able to see the slides that we're sharing. If you're just listening in the car, hopefully we can paint a wonderful picture with our words about what a bunion is. But today we're going to start with mid-40-year-old female who came to the office. I think it's been about over a year ago or so, complaining of pain to the medial. When we say medial, the inside part of her great toe joint, which had been there for some time, and having difficulty with wearing certain types of shoes or certain types of activities. And these are symptoms pretty consistent with the bunion deformity. Dr. Leonard, what might be some other symptoms that patients might present with, or if patients are wondering if I have a painful bunion, things they might be experiencing similar to the case we're discussing today?
Yeah, pretty commonly patients will have issues. Sometimes they have pain with walking, sometimes they don't. Sometimes they have a problem fitting into some or most shoes. They've tended to drift more towards sandals or something that's really spacious, or mesh to kind of take some of the pressure off the foot. A lot of times in conjunction with a bunion, they'll get some issues with the second or, some of the smaller toes, as well as they have to move out of the way. And there's some different changes that go along with the weight bearing there as the bunion progresses. So it's pretty variable in presentation, but generally there's some sort of pain that's limiting what they can do on a day-to-day basis. And whether that's in and out of shoes or just in shoes, we kind of see it all from that standpoint.
Since we're talking about, bunions and pain, I get this question all the time, when is the right time to do bunion surgery, or should I do bunion surgery? Your thoughts about, I know there's a lot of different opinions out there about that, but non-painful bunions, should those be operated on, Dr. Leonard's, in your opinion?
I always tell patients no. I'm sure someone would disagree with me somewhere, but if it's not hurting you now, it might feel worse after surgery, just with the innate risks involved. So I tell people to wait until it's affecting their day-to-day life, so that we can actually get some improvement from the surgery and have some predictable outcomes that way, versus doing it for aesthetic reasons. I really don't recommend that.
Yeah, I mean, there's risk inherent with surgery, and nerve damage, things like that could easily be part of it. So undertaking surgery on something that's not painful, definitely you're inheriting some risk there. And so I would tend to agree with Dr. Leonard's on that. So Dr. Leonard's mentioned this a little bit, although this case is not particular to this, although you can see from the x-ray the encroachment of the big toe into the area of the second toe. Ashley, some things that we kind of see on that second toe that relate to the bunions, patients might be wondering, what's my toe doing sticking up or something like that? Like, what might they see with bunions and second toes and how they relate together?
Yeah, commonly so, because the weight is getting distributed towards the outside part of the foot more than that inside where that toe should be taking the weight. more weight goes onto usually that second toe. And then if the big toe is getting in the way of the second toe, it can start to hammer or curl. And so then you're not getting full weight along the second digit either. So then it goes on that second metatarsal head, which is just that joint that is bending in that ball of your foot. And so a lot of people I know I've seen in the office, they'll have pain along along the ball of their foot because of a bunion, and their big toe won't hurt at all, but it's yet the second or the third toes and ball of their foot that hurts instead. So sometimes because of that weight distribution, you can get pain under there, you can get calluses, different wounds, stuff like that. And so that's one of the reasons to fix a bunion as well, is if that toe it will continue to try to encroach on those other smaller toes, and it will definitely shift how those toes are putting weight on the foot, and can make it a more painful situation if you don't fix the bunion.
Yeah. One common question I always get, Dr. Leonard's, on these, where that second toe is involved. Can't you just fix my second toe, or do you got to fix my bunion and the second toe? Your advice to patients who are probably dealing with that combo deformity of a bunion and then a hammered second toe. Your thoughts about that?
Yeah, I have that conversation a lot. And just for the reasons Ashley said, they have pain on the second toe. They're annoyed by the toe hammering. It's rubbing on their shoe. They've got a callus under there that bugs them. Bunion doesn't really hurt. They just kind of want that hammer toe fixed. And so you kind of have to talk about the root of the problem, what's causing that hammer toe, what's causing that improper weight distribution. And we can straighten that toe, fix the hammer toe, but the deforming force is still there with the bunion and the big toe coming over and encroaching in that area. So that is a conversation you have to have sometimes about correcting both, regardless of where their pain is, because the pain is caused essentially by the bunion and the other symptoms are arising because of that.
Yeah, I mean, I just tell patients all the time, if I fix that toe and don't fix the bunion, we're going to be back fixing that toe again in a short amount of time. And so you got to address the whole deformity, and that's what we try to do and educate patients about. So, back to this case, a mid-40 middle-aged woman with pain in the inside part of her first metatarsal phalangeal joint, where you have a bunion. And just looking at these x-rays, if you can describe them, Evan, and explain to our listeners, what exactly a bunion is, what we look at on an x-ray to kind of see whether you have a bunion or not.
One of the main things we're looking at with bunions, you're not looking so much at the prominence. That's a lot of what people feel clinically, on the inside of the big toe joint where they have that bump developing. But we're looking at the movement of that bone, that first metatarsal, away from the second metatarsal, and the gap between those two bones. That kind of is a quick glance at an x-ray at a kind of a broad severity level. You can kind of break it down into three main categories: a mild, moderate, or severe. And then with how much the big toe is shifted over, that can complicate other things. You're going to want to be able to look at the first metatarsal phalangeal joint and see if there are any arthritic changes into that joint, because that's going to determine a little bit about what the procedure of choice would be for fixing it. And then you also want to get three views that you can kind of see, the structure of the foot in different planes, and make sure that if there's no other deformities that are going on in the foot that are contributing to the bunion, because it can be exacerbated by certain other things, such as if the patient has a flat foot deformity or something like that. So you want to be able to, take the whole picture in before deciding on appropriate procedure.
Yeah, great. Well said. Ashley, here we are. We've got this 40-year-old female. She comes to the office. She sees you. You're working her up. You get an x-ray, just like Evan said. She's got telltale signs of a bunion deformity. What are her options, or any 40-year-old female or male who might be in the same situation? What are their options for treatment?
So there's non-surgical options, and that's usually trying to use like toe spacers. There's bunion pads, different splints, stuff like that, orthotics to try to support underneath that first metatarsal and try to prevent the like flexing down of that, or plantar flexion of that great toe. If there was arthritis involved, could possibly do a steroid injection in that joint. It's not going to get rid of the deformity in any way. A lot of the non-surgical treatments is just managing symptoms. So if someone doesn't have very much pain, a lot of this cannot be reversed with non-surgical or just conservative treatments. And so then if it's something that's really painful, they've tried some of these other conservative options and they want to discuss surgery, there are multiple different types of bunion surgeries. And so then it would be going into more of the procedures of trying to actually fix the deformity through a surgical standpoint.
Yeah. And just, I get a lot of questions about this, Dr. Leonard. Your opinion, or at least some education for our patients about things like bunion splints or bunion pads. A lot of patients come in with the misconception that those are going to correct their deformity if they wear those. Your thoughts about that?
I mean, I tell them if it's making it feel a little bit better, it's probably not hurting anything. But like Ashley said, it's not going to correct anything. It's only working while it's on, like most things are. And over time, people get tired of wearing things day in, day out. It doesn't fit in shoes very well, a lot of the ones I've seen. So it's just a temporary thing to try and give you a little bit of pain relief. And a lot of times I feel like people do worse with them because there's more space being taken up in their shoe. There's more pressure going onto the inside of that foot where they're already getting pain, and with very little benefit in terms of long-term correction because there's just no treatment from a splinting standpoint.
Yeah, I mean, the important thing, I think, just as was said, that's not a correction of the deformity, and it is very difficult wearing shoes. I've not found one where I thought they could comfortably go inside of a shoe at this point. A pad maybe, but not a splint that tries to torque that great toe back into a normal alignment of the joint. And so I think having proper expectations, if you want to use a splint, and it makes it feel better, then absolutely, by all means, go with that. But don't be under the assumption and the way these get marketed sometimes is that they will, correct the deformity. That's not going to happen with these splints. So these are structural deformities, and in order to correct them, they require surgery to correct the structure of the foot. So each deformity needs to be evaluated individually. That's why if you have a painful bunion, you should definitely make sure you get evaluated and have somebody who's experienced can get you the right kind of procedure. But in general, Ashley, what is the goals? What are the things we're trying to accomplish with surgery and bunion deformities?
I mean, for surgery itself is most likely the goal would be to improve pain and improve function of the foot. So we're reestablishing that alignment, which should be
Right.
in a neutral position. So we're trying to create normal pressure throughout that great toe, and then also evenly throughout those lesser toes as well. And so that way there's just equal pressure throughout that foot for pressure, no matter what procedure is used.
Yeah. Is well said. I mean, the goal is to reduce pain and restore alignment of the first metatarsal phalangeal joint, and that can be done talked about through a number of different procedures. And finding the right procedure is a really good discussion you need to have with the surgeon of choice for you to get that kind of alignment. And so I'm going to show you this other one real quick. So this is just one example of something that we could do during surgery, and this is a common procedure that we use. So for this patient, based on deformity and based on the mobility and instability, which Dr. Leonard had talked about earlier, we decided to do a fusion of the first tarsal metatarsal joint, also known as a Lapidus procedure. This allows for correction in all three dimensions of the deformity. When we deal with deformity correction, we always look at all three planes of the deformity, and in medicine we call those the frontal, transverse, and sagittal planes. But essentially we're looking at deformity side to side, up and down, and rotational types of deformity. And so this procedure allows us all three, the ability to correct the deformity in all three of those planes of the body and of the deformity. And so it simply, we do a little fusion of the first tarsal metatarsal joint, which allows us to put that metatarsal back in the correct position, back over the sesamoids. which is what was done here. And you can see here, if you're watching along from preoperative to postoperatively. I think some of the concerns that patients have is when they hear that word fusion and what that's going to be like, and things you can help patients to understand. We're fusing a very small joint in the foot here, and what they might expect, or ways to put their minds maybe at ease about this fusion.
Yeah, I'd say that most patients that do undergo this procedure have definitely a little bit of some change in how they need to work on their gait and stuff like that. But overall, they adapt quite well and just kind of learn, like I think Dr. Leonards has mentioned in another podcast, if you're listening to our last one, is that the joints around this joint will also kind of just take the load off in different ways. They'll adapt and change so that this part of the foot is now rigid, but then the other joints around it will kind of take some of that load and distribute it as well. So most people do pretty well, and it's just trying to slowly get used to the new function. But patients that we have had to have this procedure with this fusion, they're quite active and doing well.
Yeah. And some of the literature that's out there, just to educate patients, in the foot, there's lots of joints in the foot, and so some of these small joints are deemed what we call non-essential joints. So, as far as the essential joints that are there needed for functional ability of the foot, some of these small joints are what we call non-essential, and so fusing them really doesn't change their function that much at all. It may, like Ashley said, require you to have a little bit of adaptation early on while you're getting used to how the foot is functioning. But in general, you go back to full function that you were at before, but without the pain that you had with the deformity. And so, I can very confidently tell patients you're going to resume normal activity, same kind of activity you had before the surgery afterwards. To get this done. Now, we did do a little adjunct procedure here, what we call Aiken osteotomy, and Ashley, best you can describe what's that little Aiken. Those watching on that little staple up there in the big toe.
Yeah, so in the big toe, there are two bones. And so the bone that's closest to the foot, not the tip of the toe, that's called your proximal phalanx. And so that is the bone that's connected at your metatarsal phalangeal joint. And so as that toe is shifting, that big toe is going closer and closer to the second toe. Sometimes even if you align the metatarsal like we did with this fusion, that toe will still want to be over there close to the second digit. And so what we do in this procedure is we just cut a little wedge out of that inside part of the bone, the medial side, and then kind of just push it over to align it, and then put that staple in there to hold it closed, and then the bone will just fuse back together. So we're pretty much just trying to make it rectus or straight.
Yeah. And just like we talked about, from a bunion, if that big toe is over there, it can create other problems with the second toe. And so it's just a little procedure to get that big toe back straight and hopefully not have any problems with the second toe long term for the patients, and pretty quick little osteotomy procedure that we do. So like I said, the goals of this procedure were real simple for this patient: reduce pain, improve function, and restore alignment of the first metatarsal phalangeal joint, all of which were accomplished with this surgery. Of course, those listening will probably be curious about what recovery looks like for this kind of procedure. Generally, Ashley, how do we recover patients with this kind of procedure?
Since it is a fusion, we do keep patients non-weight bearing or no weight completely on their foot for 2 weeks. And then for the next 4 weeks, for that first 6 weeks of wound healing or bone healing, usually the last 4 of that are in a walking boot. And then once they've done, we get x-rays at the 6-week post-op. And then as long as that fusion site is looking pretty good, they're able to start working out of that boot into their normal shoes. And then usually we do some physical therapy, just because there is a change, there's a fusion, they're going to alter their gait a little bit to help with that. And then obviously there's swelling and stuff that sticks around longer, but they'll start to functionally be able to start working towards their shoes at about week 8 or so.
Yeah, no, that's a great breakdown of the initial recovery process. And so if you're curious, I've got a bunion, I don't know what it's going to be like, with work or with whatever, that's generally with something like this. Now, each procedure has its little nuances, but generally speaking, if you're moving bone, shifting bone, letting bone heal, about 6 to 8 weeks it takes for bone to heal, whether that's fusion or cutting the bone and repositioning. And so there's going to be some level of either non or protected weight bearing for those first few weeks, and then a transition over. I will say, from my experience, bunions do well in they transition pretty quickly, as opposed to like a big hindfoot fusion or something like that. That might take a little bit longer for transition and swelling to come down. You're back in your shoes a little quicker with a bunion than as opposed to some other procedures we did. So patient's doing well. I think we actually ended up doing her other side like 6 months later or so, and she's been happy with her outcomes and doing well, back in her shoes, back to normal activity. And that's the goal of doing all this, is restore alignment, improve function. And so that certainly can be done with bunion deformities. So if you're out there, you're struggling with bunion pain, don't know what to do with it, we encourage you to get a consult with a foot and ankle surgeon and have a discussion about what might be the best options. If that's surgery, or if it's not surgery, there's other options out there as well for you. Anything else about bunions, maybe, Ashley, that I've forgotten, or do you think patients commonly ask about that we haven't talked about today?
No, I don't think so. I do commonly also get the "how soon should I fix it" question
Yeah.
and stuff like that. So I do usually say that if the toe is already encroaching on that second toe and you've got a big hammer toe, stuff like that, you kind of, even though that bunion might not hurt, it will continue to kind of go closer and closer to those lesser toes over time. So sometimes it just gets harder to fix when it's really severe.
Yeah.
So
the larger they get, the more difficult they are to fix, the more invasive the surgery is. There's no question about that. And then I think the other thing you brought up, which is perfect, these are progressive deformities. It's slow. It's not like, you're not waking up tomorrow and you're going to have the big toe underneath the second toe, but over the years they do, get progressively bigger. And of course we have wonderful older ladies who are in our practice, and we love them to death. And they have those dreaded crossover toe deformities, because they just, they've waited so long to do anything about it. And now the first and second toe have kind of switched spots on them. And in shoeing those kind of feet become much more difficult at that point. And there's some other things that come along. So they are progressive. You should know that. It's slow, but if wearing shoes is becoming problematic, and some of the other things become problematic, I think a surgical consult is appropriate at that point. So
yeah.
Awesome. Well, I hope everybody enjoyed discussing bunions. They're super common. I think the latest literature says 40% of the population of the United States has some level of bunion, whether that's small or big. I watch people walking around in sandals all the time and see if they have bunions or not. But we'd be happy to talk about those things with you in our office at any time. We are the Foot Fixers, and this is the Fix My Feet podcast. Check us out on social media at Platte River Foot and Ankle on Instagram, Platte River Foot and Ankle Surgeons on TikTok and Facebook, or check us out on Facebook, Fix My Feet podcast. Until next time, we hope everybody has a wonderful day. Thank you for the listen.
Thank you.
Thanks for listening to another episode of the Fix My Feet podcast. To schedule an appointment with one of our providers, visit www.prfootandankle.com.